Hello, my name is Dr. Eduardo Vasconcelos, and I have specialized in men's health for more than 3 decades, with a particular focus on the problems men face in older age. Today, I'd like to discuss a few important points with you. Have you noticed any changes in your intimate life? Perhaps your erection isn't what it used to be, sensitivity has decreased, or you prefer not to talk about it, assuming it's a natural part of aging. In that case, I want to be completely honest. After 60, the male sexual organ needs closer care. Many men, unfortunately, don't realize this, and ignoring the body's signals it can lead to a complete loss of sexual function, lower self-esteem, and vascular problems. A study published in the Journal of Sexual Medicine states that after age 60, more than half of men show signs of hidden atrophy of the penis. This condition is characterized by reduced elasticity of the corpora cavernosa, decreased blood flow, and a gradual reduction in penile size, changes that may go unnoticed by the man himself. In addition, scientists at Boston University found that irregular erections accelerate the development of fibrosis in penile tissues, which can later lead to difficulty achieving erections and, in severe cases, their complete impossibility. Thus, neglecting penile health can provoke not only sexual dysfunction, but a complete loss of function. In this video, we will examine what changes occur in men's health after 60, what hidden dangers await men at this age, and how you can start protecting your male strength, blood circulation, and potency today in a natural and effective way. You will also learn a secret recipe that directly affects the blood vessels of the penis. Understand that caring for men's health is not only a matter of intimate life, but also of vital energy, longevity, and overall well-being. Pay close attention, because the information I'm about to present can dramatically change your understanding of your own body. Let's begin with the first part. What happens to the penis after 60? Upon reaching this age, the body undergoes many transformations, and one of the most sensitive, yet oddly under-discussed, areas is the penis. Over time, testosterone levels gradually decline. This hormone is responsible not only for sexual desire, it directly affects vascular elasticity, penile sensitivity, nitric oxide production, and erection firmness. At the same time, blood flow in the intimate area tends to decrease. This is because the penile arteries are very thin. They are much more sensitive to the buildup of fatty plaques, inflammation, and thickening of vessel walls. The consequences are reduced elasticity, difficulty achieving and maintaining erections, a longer recovery period between stimuli, and in some cases, a noticeable reduction in penile size, both flaccid and erect. One more key point. Nocturnal and morning erections that occur spontaneously during sleep become less frequent. Yet these erections are not merely about sexuality. They act as a physiological workout, oxygenating the corpora cavernosa and maintaining the internal health of the penis. Without this regular oxygenation, the risk of cavernosal fibrosis rises, meaning loss of elasticity, progressive shrinkage, and impaired erections even when desire remains. Finally, these changes do not mean that sexual life is over, but they do demand attention, care, and action. Unwillingness to acknowledge what's happening today can turn into bitter regret tomorrow. Part 2. Dangerous. Hidden threats that men often ignore. The main danger isn't in what you feel, but in what happens invisibly. Many men in their 60s, 70s, or 80s perceive loss of erection, penile shortening, or decreased libido as a natural process, yet substantially more serious problems may be concealed behind this. One often overlooked risk is hidden penile atrophy. When circulation in the intimate area is impaired, erectile tissue deteriorates. The corpora cavernosa, which should be elastic and engorged with blood, gradually lose their spongy structure and become hard from within. This phenomenon, known as cavernosal fibrosis, can develop unnoticed until it reaches a critical stage. Another risk is the seemingly inevitable decrease in length. Prolonged absence of full erections can lead to the penis, like an unused muscle, losing its function, structure, and tone. Such structural changes resulting from long inactivity cannot be reversed by medication alone. It is important to understand that erectile dysfunction is not only sexual discomfort, but also an early sign of cardiovascular disease. Research shows that impotence, especially when it develops gradually, can be one of the first signs of coronary artery blockage. There are emotional consequences as well. Men who face these silent changes but have no one to talk to often fall into anxiety, frustration, and isolation and lose self-esteem. The body suffers, the mind hurts, and one's attitude toward aging becomes increasingly heavy. We must discuss this topic seriously and openly, relying on reliable information and without taboos. The price of silence is high, but prevention remains the best solution. Let's move on to 5 habits that can seriously worsen the condition of the male reproductive organ. If the penis is inevitably subject to natural age-related changes, many everyday habits speed up this process. Sadly, many men fail to notice for years how their behavior harms their own masculinity. Here are concrete examples. The first habit, standing in the way of full masculinity, is a sedentary lifestyle. Poor circulation is the chief enemy of male potency. Without movement, blood cannot circulate properly, vessels lose their ability to dilate, and oxygen delivery to the penis suffers. Lack of physical activity also reduces nitric oxide production, which is required for vasodilation and thus erection. The second habit is smoking and excessive alcohol. Cigarettes directly damage the endothelium, the inner lining of blood vessels, causing chronic vasospasm, inflammation, and plaque buildup. Excessive alcohol disrupts hormones and, over time, reduces penile sensitivity. Both factors feed erectile dysfunction. The third habit is the absence of sexual activity or regular stimulation. Even if a man is not sexually active, the penis should be regularly stimulated by spontaneous erections, mindful touch, or safe masturbation. Without this, the corpora cavernosa can atrophy, harden, and lose the ability to hold blood. The fourth habit is pro-inflammatory eating. Excess sugar, fried foods, ultra-processed products, and trans fats impair circulation and provoke hidden inflammatory processes in the body. Similar processes affect the penile vessels, leading to dysfunction and reduced sensitivity to sexual stimuli. The fifth habit is long-term use of certain medications. Antidepressants, anxiolytics, and some antihypertensives can affect libido, erection, and sexual activity. It's important to understand that stopping necessary medications is not the solution. Avoiding consultation with a doctor about safer alternatives for sexual health is the mistake. These 5 factors, like slow poisons, gradually undermine potency and vitality, not causing instant collapse, but ultimately leading to chronic, hard-to-treat dysfunction. Fortunately, all of these can be corrected. This leads us to the next step, Part 4. 7 measures for caring for men's health after 60. Having reached the culmination of our video, we turn to the key, practical, and necessary measures for caring for your penis after 60. These are not just general tips, but clinically grounded actions that make the difference between preserving penile health and its gradual decline until it becomes irreversible. These actions directly affect blood flow, erectile tissue, sensitivity, and response to arousal. Disregarding these principles can lead to loss of potency, reduced self-esteem, and even loss of intimate independence. Regularly following these steps, however, can radically change the situation. Let's begin. Step 1. Maintain regular erections even without intercourse. Frequent erections are necessary to keep penile structure healthy by delivering oxygen and nutrients to the tissues. This preserves elasticity, prevents fibrosis, and protects against shrinkage over time. After 60, the natural frequency of erections, especially nocturnal ones, decreases. Therefore, consciously stimulating erections, regardless of sexual activity, plays an important role in maintaining physiological function, similar to training muscles to prevent atrophy. Ignoring this need can lead to internal hardening of the penis, loss of function, and a final decrease in erect size. To preserve penile blood flow, avoid a sedentary lifestyle. Because penile arteries are thin, The penis is especially sensitive to circulatory disturbances. Even small reductions in blood supply can negatively affect erections. After 60, inactivity worsens the problem by reducing nitric oxide production, which is key for vasodilation and filling the corpora cavernosa. Weak, unstable, short-lived erections are a direct consequence of sedentariness. Low activity also promotes abdominal fat, insulin resistance, and hormonal imbalances, all of which harm penile function. Maintaining physical activity through regular walks, cycling, stretching, and moderate strength training is a simple but effective way to preserve erections and the health of the male reproductive organs over the long term. Effective management of hypertension, diabetes, and high cholesterol is a key factor for penile circulation. These three ailments, high blood pressure, elevated blood glucose, and high cholesterol, pose a serious threat to the penile vasculature. Most worrying, they act silently, damaging the penile microvessels long before heart symptoms appear, gradually thinning arterial walls. Diabetes harms nerves and microcirculation. High cholesterol raises the risk of blockages in the arteries supplying the corpora cavernosa. The result is progressive erectile dysfunction, often mistakenly attributed to aging when in fact it is an early sign of vascular disease. Preserving erectile health through proper nutrition, physical activity, and, when needed, medication under a doctor's supervision is an effective way to prevent disease and protect the penis from irreversible damage. It is also important to monitor sensitivity and any changes in penile condition. Many men recognize erectile problems only when function is already impaired, but the body signals earlier with subtle signs that often go unnoticed. Loss of tactile sensitivity, changes in skin texture, deformity, reduction in flaccid size, and progressive curvature during erection can all be early warnings. Such changes may indicate low hormones, penile fibrosis, or Peyronie's disease, in which fibrous plaques form and cause curvature and pain. It is important to regularly monitor your penis, pay attention to any changes, and share this information with your doctor. Overlooking these signs can allow a treatable issue to become chronic. Remember that penile stimulation is not only a matter of pleasure, but a vital component of its health. After 60, natural sexual activity often decreases, and many men leave the penis inactive for long periods. Stimulation is a physiological practice important for maintaining nervous function, blood flow, and erections. Simple actions, gentle touch, pelvic floor exercises, and even imagined erections, without pornography, help preserve sensitivity, blood supply, and firmness. The main goal is not orgasm, but maintaining tone and functionality. Without regular stimulation, the penis loses function, hardens from within, and responds less to arousal. Stimulation is care, mindful, respectful, and systematic. 6. Regular urological checkups are necessary. The penis, like any organ, could develop disease, often silently. That is why preventive examinations should not be ignored, especially in older age. Routine visits to the urologist help detect issues in time, such as penile fibrosis, hormonal imbalance, vascular pathology, internal injury, and even early signs of cancer. In addition to a general exam, the doctor may order specialized tests, such as penile ultrasound with Doppler to assess blood flow, testosterone levels to identify hormonal deficiency, and evaluation of penile sensitivity if tactile perception declines. Prostate evaluation, which directly affects sexual activity, includes digital rectal exam and prostate-specific antigen (PSA) testing. These assessments are performed even before symptoms arise, distinguishing prevention and preservation of potency from struggling with established consequences. When treatment is less effective, it is also important to maintain a normal testosterone level, both naturally and with medical help when appropriate. Testosterone is the key hormone for libido, erection quality, penile sensitivity, and responsiveness to stimulation. After 60, levels usually fall gradually. This decline affects more than desire. It harms penile health by impairing blood flow, weakening erections, reducing sensitivity, and promoting erectile tissue atrophy. Fortunately, there are safe ways to maintain or restore testosterone. Balanced nutrition rich in healthy fats, zinc, and vitamin D, regular exercise, stress management, and quality sleep are essential. In some cases, hormone replacement therapy under medical supervision may be needed. Do not accept fatigue, low libido, and erection problems as unavoidable with age. In most cases, these symptoms indicate low testosterone, which can be successfully improved. Part 5. A natural recipe to improve penile blood flow. This recipe combines three components that directly influence the health of penile vessels. Together, they stimulate nitric oxide production, improve blood flow in the corpora cavernosa, increase erection elasticity, and support normal hormonal balance. In a blender, place half a fresh beet diced. Then add the white part of the watermelon, the layer between the green rind and the red flesh. Add 2 tablespoons of raw pumpkin seeds with their tender skins and half a cup of liquid. To simplify, blend everything for 30 to 40 seconds until smooth. Strain if you wish. For best results, drink this in the morning or 30 minutes before physical activity, 2 to 3 times per week. Beetroot contains natural nitrates that the body converts to nitric oxide, helping dilate vessels and improve blood flow to the sexual organs. The white part of watermelon is rich in citrulline, which enhances vasodilators and improves penile sensitivity to stimulation. The seeds provide zinc and magnesium, minerals necessary for testosterone production and for protecting penile tissues from fibrosis and age-related vascular changes. This recipe is a simple, safe, and effective way to support penile circulation naturally and over the long term. For men over 60, this video is not just a warning. It is a call to action. Ignoring penile health means slowly but surely losing potency, sexual activity, self-confidence, intimacy, and dignity. Sadly, no one talks about this in time. It's not only about physical closeness, but also about circulation, self-esteem, vital energy, and independence. Caring for the penis is caring for the whole body. They are closely interconnected. If this information is new to you, share it with others right now. Don't let it fade away until it's too late for those close to you. Share this video with those who could truly benefit: friends, relatives, colleagues. Such valuable information can save marriages, self-esteem, and even lives. Silence about it can be very costly, while prevention is almost free. Until next time, and I wish you strong health. M.